I warmly welcome Aboriginal and Torres Strait Islander people joining us today. I also pay my respects to the elders of the traditional lands from where our participants and presenters are joining us from today. So we have quite a few people registered to attend this event today, over 100. From a really wide range of backgrounds and services. We've got young people, we've got family members and carers of children and young people, we've got health professionals and community professionals too. So it's really great to be able to welcome such a wide range of people. I'm so looking forward to the conversation that we're going to have. A little bit of housekeeping as we start. It'd be great if you could pop yourself on mute if you're not one of our speakers, just to help us not be distracted and so that the participants can all hear what's happening. If you'd like to ask a question or make a comment, we'd really welcome that. And the way to do it is to type it into the chat function. So then everyone will be able to see then what it is that you are commenting or questioning, and they can also reply to you. So you're very welcome and in fact encouraged to sort of have that conversation running in the chat by typing as we go. So our speakers today are going to answer as many of your questions as they can in the time that we have, which is an hour. And if we can't get to everything today, we'll aim to answer the questions on the Canberra Health Literacy website, and we'll also circulate them by email after the event. So again, remember to put them down in the chat function. We are recording today's webinar and we'll share the recording with you again by email and on the Canberra Health Literacy website. So we have a fabulous range of speakers today who really have a lot of knowledge and experience in helping young people and children to be involved in health decision making. We've got Lizzie Harnett, who's the CEO of the Association for the Wellbeing of Children in Healthcare. We've got Hugo Taheny, who's a Down Syndrome Australia Health Ambassador, and his family, Louise and John. We've got Natalie, Health Program Manager of Down Syndrome Australia, and we've got Shannon Kollak, who's the Executive Officer of the ACT Down Syndrome Association. So we might crack on, and please join me in welcoming Lizzie Harnett, who's going to open today's webinar. Take it away, Lizzie.
Thank you, Kate. Now I'm just going to try and share my screen. I'm not the world's most proficient, but the practice went well. So can everyone see that? Excellent. I just want to thank the Canberra Health Literacy Network and healthcare consumers so much for inviting me to speak this afternoon. It's a topic that I'm extremely passionate about, and as I said to Sarah, the problem will be me stopping talking. So, so hopefully someone will stop me at about 15 minutes, and because I could talk about this for a week at least. I just really wanted to start by acknowledging the traditional custodians of the land on which I work, which is the Wallumadjul people, and where I live, which is the Wongal people, and again, just pay my respects to elders past and present. It's particularly important today, being the first day of the start of Reconciliation Week, that we sort of poise and stop and think, what can we really do better in terms of moving forward and getting true reconciliation. So that's a beautiful slide there. I've borrowed that beautiful picture there from Youth Action, their latest newsletter. I think it's gorgeous. So I'll very quickly just talk to you about Orch, as some of you might have heard of us. We are a national not-for-profit advocating for the needs of children and young people and their families, and we've been doing that in Australia for almost 50 years. We were formed in 1973. And really the basis of what we do is advocacy, but really a partnership between children, young people, health professionals, community. And there's a variety of ways that we do that, but I won't take up too much time talking about that. It's on the slide, and I think you'll be getting a copy of the slides. So a little bit about me. I am obviously the CEO of Orch, and I'm really have been dedicated to the rights and needs of children and young people in healthcare from quite a young age. I'm one of 7 children. I became an auntie at the age of 15. I have 16 nieces and nephews. So I've been involved with children and young people for a very long time. I'm also a children's physio, is my kind of professional background, and I've been involved in the public sector, the private sector, the Ministry of Health, health management, and a range of other things. So I've sort of been on all sides of this discussion about participation and partnership with children and young people. Now, with this group, I don't think I really need to spend very much time talking about why involve children in decision making. But I'm just going to talk a little bit about this, and that is that it's a basic human right. Children, just like adults, have a set of basic human rights, and I think we all know about the Convention on the Rights of the Child, which is 20 years old. And no, 30 years old, it's just had its 30th birthday. And Australia is a signatory to that. So we basically don't have a choice about children participating in decision making. It is a basic human right. And as Australia is a signatory, that needs to be facilitated by health professionals. So I just will flick over this, but Children's Healthcare Australasia and ORCH were involved in a project 10 years ago to actually look at the Convention on the Rights of the Child and say what sort of rights should exist for children and young people in the healthcare system. So there is, you can see here there's the Charter of the Rights of Children and Young People. It's 10 years old now, but it's actually still as relevant today as it was then. And there's a set of rights for rights charter for children, younger children, and then a rights charter for young people. Now the illustrations are getting a little dated, but the content is absolutely as relevant today as it was 10 years ago. It enshrines that right to participate and be involved in things that affect you. So look, I'll just skip over this, but really, why do it? Because that's the only way to get a good result. It's actually, it not only is it a basic human right, but it's actually the only way to make services work well for children and young people. Unless they are effectively involved in the decision making from what's happening to themselves at an individual level, but then also what the system should look like. You just actually cannot have good services that meet the needs of the children and young people using them. So, but there's a lot written about the actual huge positive outcomes of involving children and young people effectively, and I've got some references at the end of the talk because there's a lot more that could be said about that. But again, I'll skip over it because I think people want to hear a little bit more about overcoming barriers and things like that. Look, I've popped this quote in because it's just one of my favourite quotes. It's very sobering. Whilst children are 1/3 of our population, children and young people, 1/3 of the world's population, they're actually all of the future. And I think that puts why and the importance of doing this well in perspective. They are not only the health consumers of now and the future, but they're the health care providers of the future as well. So we need to get this right. So I think that people were very interested in a little bit more of how to actually do this. I think there's enormous will in the system. I call it will and skill. There's an enormous will in the system. People want to do this, I think, and we'll talk about the barriers in a minute to doing this, but they really don't know how to go about it. And there's quite a bit of fear and anxiety, even from people who work solely with children and young people, in actually involving them in decision making, which is interesting. Now this is top 10 tips of engaging with children and young people. It comes from the New South Wales Advocate for Children and Young People, who have extensive resources on encouraging participation from children and young people. And I would suggest I've put them in my list of resources, but they have some amazing resources to use for organisations and for young people, to support young people in being advocates for themselves and for, you know, as a sort of system advocate as well. And I love these. Treat children and young people with respect, basic, but we still don't do it in every situation. Don't talk down to children and young people, and I see that all the time. Orchard's just finished a piece of work on ageism in healthcare for those under 25, and some of the stories we heard and the experiences we heard were quite sobering in terms of the sort of discrimination, but also the talking down to young people and minimalising their lived experience. Don't be a try-hard. I love this one because sometimes, you know, we get caught up in trying to be groovy, trying to be hip, you know, doing a TikTok, you know, instead of just having a conversation. I'm not a great TikToker. I don't think young people expect me to be. I'm too old to be a good TikToker. So just don't try too hard. Take your lead from them. Don't make assumptions about what children and young people are capable of. I was saying to someone, I was at my child's gymnastics, putting a few notes down, and one of the other mums said to me, "Oh, what are you doing?" I said, "Oh, I'm doing a talk on involving children and young people." She goes, "Oh, well, you can't really do that, can you? Like in healthcare, it's too important." I'm like, that's why you do need to do it, because it is important. So again, even people with children themselves can really underestimate what children and young people are capable of in terms of contributing their lived experience. Kids and young people are as diverse as any other population. I hear a lot from young people that that health professionals in particular just think they're all into the tech. And I've had one young person say to me, you know, I don't like tech. I don't use Facebook. I'm not on Instagram. I know that's unusual, but, you know, it really annoys me that that's how people want to engage with me because, you know, I have a right to be different. So they're as diverse as adults. We're going to talk a little bit more about actually ensuring that you are very clear with children and young people about what they can and can't be involved in. So we make the mistake of actually, you know, saying, hey, you can have a say in the system, you can have a say in when you have your tests or, you know, what medication you should be on, when in fact they are not decisions that we really are going to let them have a say about. So I'll talk a little bit more about the barriers there. Be open to new ideas. This I've found engaging with children and young people myself so refreshing because they come up with some fantastic thoughts and solutions that are really out of the box, really quite creative. They're not constrained like, you know, a lot of adults who've been working in the system for a long time are. Give them time and space, and I would say developmentally appropriate kind of time and space to have their say. Clear limits and also, yes, steer clear of jargon. And I find children and young people are great at just saying, hey, like, what are you talking about? You know, so if you start to use acronyms, again, it's a great leveler because people just say to you, you know, can you actually talk plain English, please? So those top 10 tips are really the principles for effectively engaging, and they are true whether you're talking about engaging in decision making at the bedside or what I like to call, you know, engaging at the boardroom level. And there should be engagement with children and young people from the bedside as healthcare recipients or consumers of healthcare, right up to that strategic level. They should be involved in the strategic plan for the service that is meant to be there to meet their needs. But the participation looks a little different, and we'll talk a little bit more about that. I've just put 2 links in the slides. A fantastic, a couple of years ago, they ran a children's parliament. It was amazing, and there's just a little snippet there. And Create is an organisation for children and young people with a lived experience of being in out-of-home care, who do amazing things in terms of participation as well. And they've got a great little video there about what participation means to 3 young people who've been in care. Critical to involving children and young people is ensuring that you really are clear about what the sphere of influence is. And really involving them as early as possible in decision making. And again, this is as pertinent to bedside as to boardroom participation. And don't promise things that you cannot, because there's just nothing worse than being promised that you can have a say and that your say will contribute to change, when that is actually not the case. And I think that even more than with participation with adults, that is done a lot with children and young people. So they'll be very mindful of that. And a way of actually ensuring that that doesn't happen is really to involve them at the very beginning. So involve them in the participatory processes. Now, we don't have a lot of time because I'm running out of time here. This is there's lots and lots and lots of participation structures. This is a good one from IAP2. It'll be in the slides, but it's good to actually say to children and young people, well, this is what we're at. We're involving you. We're not really collaborating with you. You're not going to have a huge say in what happens. We're just really involving you and getting a bit of your feedback. Or we're not involving you at all. We're just informing you of whatever. Or you can be part of the decision-making process. So this is, I think, what people really want to hear about. At the bedside, it can be as simple as actually involving even the youngest child by just speaking to them about what is going to happen. And if there is anything about that process that they can control or be in charge of, then letting them be. So if they need to have a blood draw, do you want that do you want that on your left hand? Do you want that on your right hand? Do you want that at 10 a.m. or, are you meant to be going to school? So it's better for you if it's 3 p.m. or so it's small incremental input into decisions about their care in a developmentally kind of appropriate way, obviously, can make an enormous amount of difference to a child. And I've seen extremely young children participate in decision making, toddlers involved in decision making. I did actually, because I've been into decision making for children and young people for quite some time. When I had a child, I started practicing when she was very, very young, saying, "So, Mummy wants to do this. Is that okay? Should we do that now?" Obviously, I didn't say, broccoli. Yeah, Mummy wants you to eat broccoli. Do you want to eat broccoli? Obviously, that's not, most kids are going to say no. But, involving them in whatever decisions they can make actually really does contribute to their sense of control and their well-being. And we see this a lot with immunisations. People talk about children developing needle phobias, and adults, we have quite a few resources around this. But again, if children can have a sense of control about that, if they can be talked through the process, what they are and are not in control of, some distraction techniques, some role play, and control of whatever it is that they can control as part of that process. Also involving in bigger things, bigger decisions, if staff don't feel they have the skills to actually involve the people who do. And that's really critical. In every healthcare facility, there are people who have incredible skills at engaging with children and young people, child life, psychologists, the education teams. I know in smaller facilities, less of those exist, but there's generally always someone who is able to help. There's also so many books, so much is on YouTube that really you can search for just about anything now and find a clip that you can use for helping a child or young person be involved in their decision making. I just want to give you a really quick example of as young as when I was at Children's Hospital Westmead, we had children as young as the 3 and 4 participating in improvement projects. One was around food. We had taste testing for groups of children. We worked with the school, you know, drawing us pictures of how they felt about, you know, the play equipment in the ward, what they felt about, you know, should they be able to wear their own clothes in hospital? And it's amazing what some very, very young children can contribute. When I was helping design the children's rights in healthcare, again, some very young children were involved in that. And basically what we said, we had focus groups saying, what would you like us to tell the doctors and nurses about what they should do to help you be happy and to help you be healthy and to help you have a good experience of being in hospital? And again, quite astounding what comes out of that. As a very, very young physio, I think it was my first or second year out, I had a group of young people with cystic fibrosis, and they were extremely unhappy always. At 8 a.m. in the morning when I do my physio treatment, extremely unhappy. And I said to them one day, look, what's the story, guys? You know, you're always so miserable when you come, when I come to see you. And they said, oh, we hate that morning treatment. It's horrible. But you'll never get our doctors and our parents to change that. So I had a meeting with the doctors and the parents, and they said, oh, no, you know, the parents said, you won't get the doctors to change that. And the doctors said, oh, no, you won't get the parents to change that. Anyhow, basically everyone was sort of unhappy about that early morning, but it was the young people who actually identified that we could change that. It wasn't an unchangeable thing, but that actually came from their out-of-the-box thinking. So I'm running out of time here, but I'll just talk a little bit about the barriers. The main barrier really is just people's attitude to whether this actually can be done, whether the results of this involving children and young people is going to get results, whether the time and resources that people think are extensive but are really not are going to be worth it. And there's also quite a bit about rigid structures for participation in healthcare. We love an advisory council back in healthcare, and that often doesn't suit a group of children and young people. So really, again, the key of all of this is really to involve children and young people from a very early age and stage of any participation process. And I'll send some more notes out with this because I know that I've almost run out of time. In terms of diversity, again, don't think that all children and young people of any particular group are all the same as well. That's a big mistake that we make. And involve them in the design of any process, just like you would with any other groups of children, but also really ensure that if there are any adults that already have a skill set with working with particular groups of children and young people, that you involve them at an early age and stage as well. Don't reinvent the wheel, I suppose, is what I'm saying. Modelling and play are amazingly valuable tools, particularly for younger children. And I think I've run out of time, haven't I? So, but I might just finish on this quote, which I love, from Oliver Wendell Holmes. Pretty much all the honest truth telling there is in the world is done by children and young people. And I would say that that's a sort of probably a good spot for me to finish on.
Thank you so much, Lizzie. That was fantastic. It really resonated with me, both as a mother, but also as an advocate. And I want to put my vote in too for thinking creatively as a health service of different ways that you can actually involve children, not just the advisory council way. Yeah, there are many ways to hear people's voice. So, and I understand, Lizzie, that we'll be able to circulate your slides after this so that people can click on the links and follow up some of that. Okay. Yes. Fantastic.
And Kate, I might just mention too that Orch is working on some resources for people involving children and young people in decision making. We're putting a grant. Hopefully, the grant comes through, and you'll have some resources from us, sort of, you know, in the near future.
Great. Well, we'll circulate them when they're there. Okay, fantastic. Okay, so now I'd like to hand over to Shannon Kollak, who's from the ACT Down Syndrome Association. You there, Shannon?
I am. Thank you very much.
Take it away.
So I won't actually spend too long talking today. I'll just briefly introduce myself, tell you what I do, and then I'm going to hand you over to my colleagues from Down Syndrome Australia. So I'm part of the ACT Down Syndrome Association, and we're based here in Pearce in Canberra, and we provide support and information to families and to people with Down syndrome and other intellectual disabilities and their entire support networks, which includes health professionals, teachers, employers, etc. So if there is anyone after today's webinar who's looking for some on-the-ground support in terms of the things that we talk about, you can contact us at ACT Down Syndrome to discuss that a little bit further. I do have some information I can maybe give out at the end or in the chat about some particular stories from some of our members around involving their young people in health decision making, but I'll sort of leave that maybe until the end, until we get through the presentations. So I'd like to hand over now to my colleague, Natalie Graham from Down Syndrome Australia, and she's going to introduce the Health Ambassador Program and our Health Ambassador, Hugo. So Natalie, over to you.
Thanks, Shannon, and thank you, Health Literacy Network, for inviting Down Syndrome Australia to speak today. We would also like to acknowledge the traditional custodians of the land that everyone is meeting on, and elders past, present and emerging. Down Syndrome Australia, as Shannon has said, is made up of the state and territory organisations that provide support, information and resources to people with Down syndrome from around the country and their families. Down Syndrome Australia also believe that including people with disability, no matter their age, in their own health conversation is vital to positive health outcomes. To this end, in 2020, we received funding through the ILC grant program to carry out our project, Inclusive Communication, Improving Health Outcomes for People with Down Syndrome. And this also, more broadly, is for people with intellectual disability. The project consists of two main parts. The first part is the component of supporting people with a lived experience to take an active role in sharing their health experiences with health professionals. As part of this, we've recruited 10 health ambassadors with Down syndrome from around Australia. Hugo is sitting there on the screen. Hugo is our South Australian representative, and Hugo was onboarded earlier on this year. And we set them up for success. We did training. All our health ambassadors have done an 8-week online training course in public speaking, and they're all sensational. The second part of our project is about developing tools and information for healthcare professionals. We are in the process of doing webinars, e-learns, and we have created a health tool, which there will be a link on the last slide that we're about to show. The health screening tool for people with Down syndrome is to highlight that there are some extra health needs and that GPs and healthcare workers need to be cognizant and aware of this. We encourage annual health checks for all people with Down syndrome to improve their health outcomes by creating an environment of comfort and support and trust with their GPs. This allows the GPs to see their children as well children, and so when that child becomes unwell, they too, like the parents, can see the difference and execute a plan from that, depending on the health needs of the child. So today, Hugo and I and his parents, John and Louise, will present to you a slide presentation that we have put together that talks about our inclusive communication and the relationships that improve health outcomes with healthcare workers. So I'm going to do my technical bit and share my screen. Can we all see that slide? Okay, so Hugo, off you go.
Inclusive education.
For people with Down syndrome. So these are a couple of our healthcare ambassadors at our launch in March at Parliament House, which was unbelievably successful.
Hi, my name is Hugo.
Hi, my name is Hugo.
I'm
I'm
a health ambassador.
an ambassador
Down syndrome
for
Australia
Down syndrome Australia.
from South Australia.
South Australia.
Hi, this one. I'm also a world champion
Also a world champion,
in shot put discus,
shotput discus,
and I like to be called.
and I called the Kolak star.
I'd like to talk to you
I like to tell you
about how healthcare workers
about workers
can better care
better
for people with Down syndrome.
for people who have Down syndrome.
So on behalf of Hugo, John and I would just like to share a couple of things, and we'd like to say thank you for the opportunity to share Hugo's story, which has been quite intense over the past 20 years. So Hugo has just transitioned from the amazing Women's and Children's Hospital in Adelaide to the Royal Adelaide Hospital as a 20-year-old. And we have had the most incredibly positive experience, primarily, at the Women's and Children's. And we'd like to share how that happened for us, I guess. For the first 6 months, so Hugo's the youngest of our 5 children. For the first 6 months of his life, we had suitcases for 7, 5 children under 6, and John and myself in the hallway, because we were going to the Women's and Children's Hospital weekly. So we live in rural South Australia, so that was a 6-hour round trip. So every week we were told to have our bags packed with us, because it might be time for him to go to Melbourne for life-saving heart surgery. So we did that for 6 months, and then a little miracle happened where we could unpack the bags, and at 2, Hugo had heart surgery. For the past 20 years, once a month, we've driven to the Women's and Children's and had extended stays there with Hugo for different health reasons. We were anxious, John and I were anxious, and Hugo, about the transition to the RA, because we'd built such beautiful positive relationships with so many of the medical staff there, and they knew Hugo, and it was often, these results aren't normal, but they're normal for Hugo. So it was great that we felt so supported. About half an hour out of Adelaide, we would put the Emla cream on his arms, and he'd say, "It's time for my arms to go to sleep now, Mum." So we had a pattern and a routine going, but it's been a long haul.
So that talks to what Elizabeth was speaking to before about creating an environment that is inclusive of the child, and making them part of the conversation and part of the routine of going to the hospital or the healthcare setting. So,
Sorry, Nat.
That's all right, absolutely.
Sorry, go
so
on.
there are approximately 15,000 people in Australia with Down syndrome. And just a few quick little facts about Down syndrome for those in the audience that are not fully across people with Down syndrome. Genetically, they are more like their families than each other. They all have their own individual personalities, strengths, support needs, and that can't be predicted before birth. In general, people with Down syndrome have mild to moderate intellectual disabilities, low muscle tone, and a higher chance for some health issues that I've already alluded to. But most of these health conditions, and Hugo is living proof, are treatable. Most people with Down syndrome will now live long into their 60s and lead a healthy and fulfilled life. With the appropriate support, people with Down syndrome and all people with intellectual disabilities can attend school with their peers to participate in meaningful employment. They can continue to learn within a supportive environment, and they have the right, as Elizabeth said, to be part of all the decisions that affect them. They have the right to access appropriate medical intervention in a timely manner. And as our board member, Claire Mitchell, who also has Down syndrome, says, Support in all its different forms is the reason I live a happy and fulfilling life. So in 2020, we did a survey at the beginning of the ILC grant, and we surveyed people with Down syndrome about their experiences and thoughts on when they interact with healthcare workers. And these are the four main things that the responses from the people with Down syndrome came up with.
Speak slowly.
Speak slowly.
Be patient.
Be patient.
Listen to me.
Listen to me.
And support. Talk to me as a person.
And support me a person.
So these are the things that people with Down syndrome identified when they see their healthcare workers. Now, these were from adults, but these adults have childhood experiences of going to healthcare workers. So they're really important part of what people with Down syndrome think is the importance of interacting with healthcare workers. So now, part of, as I said before, part of what we have done as our grant is the healthcare ambassadors from around Australia were supported in creating their own health speeches to deliver to healthcare workers. Whilst we were in Canberra, we videoed some of our health ambassadors delivering their speeches. And I'm going to play to you today Hugo's video of him delivering his health speech.
Hi, my name is Hugo. I want to help people who have Down syndrome have a better life. When I'm born, I was very sick. Doctors told my mum and dad, take me home, lock me up, I'm not survive.
So people with Down syndrome have poorer health outcomes than others, but they don't need to. Compared to the general population, people with an intellectual disability experience over twice the avoidable deaths and lower rates of preventative health care. With the right medical treatment, people with Down syndrome can lead healthy, productive lives and be contributing members of their community. Hugo's a world champion, and he's proof of that. He wants doctors to be friendly and to get to know him. If they have good relationships, their health outcomes are more positive. And Hugo says, maybe you need to explain things a different way. Maybe you need to use pictures to help me understand, and maybe you need to slow down. Just because some can't read as well, you do not understand what we are saying. We can understand and do understand. We need to make sure that we understand.
My doctor told me my muscles lifting muscle, not running, because I'm retired. My coach and I tried to communicate for my world champion. Thank you, my message.
So through inclusive communication, Hugo can become a world champion. So through inclusive communication, health outcomes can become better. Like Lizzie, we will be running out of time, so I won't go through this slide. It will be on the recording. But essentially, there really are three main points. Give the person time. Doesn't matter how old they are. Give them time to process the information. Be patient. Break down the information. Give them support. Use visual supports. Use supports that help them understand, and connect with them and check in with them to see that they understand. Use a health diary to record their health visit. Use annual health checkups to make sure that you are seeing a well child and then you're seeing a child that is not so well. So you too can see the difference. And use language that is appropriate for that person. So find out what their main form of communication is and use that. They may need support and perhaps an interpreter for Auslan, but that's a really important part of visiting the healthcare worker, using a language that is appropriate for the person.
Having transitioned from paediatrics to adult doctors in the last year with Hugo, we've had to relook at how those relationships have been so successful with Hugo. And there's a common thread that Hugo's message all the way has been to be kind and respectful. And it's a two-way street, being kind and respectful to everybody you meet. So when we've helped Hugo create new relationships with doctors, we've just tried to help that conversation along. Hugo has interests in singing, dancing, sport, animals, which are pretty universal with everybody. So it gives him something that he can have conversation and build friendships with. Dr. Disney, who is Hugo's new cardiologist as an adult, the first meeting they ever had, they just started talking about Hugo's athletics and were chatting away. And when he finished that appointment, it was time to go to Hugo's haematology appointment. And Dr. Disney said that that's okay, I'll walk Hugo to his next appointment. Might have taken 30 seconds out of Dr. Disney's day, but to see the pair of them walk off down the corridor having a chat, that relationship is now more of a friendship. So Hugo looks forward to going and seeing him. So I think that common thread of being kind and respectful all the way is really successful.
I think, as John said, the importance of building those relationships can't be stressed enough. Right from the start, we've worked with the health practitioners to get the best outcomes for Hugo. Good communication, as Natalie's mentioned, is so important. And I'm a lists person, so write things down, because that allows you to come back and go over those the information you've taken in, and it helps you to process things. So it allows you then to question what you might not have heard or what you don't know, and it's really important to follow things up as well. Hugo, you really like it when your doctors are kind and helpful. Yeah, do you want to say that? When they're kind and helpful?
Kind and helpful?
Yeah, kind and helpful is Hugo's favourite thing.
So as John and Hugo and Louise have said, it's about a team. It's about teamwork, and it's you know, I have a daughter who is 17 now with Down syndrome, and I call it Team Henny. So no matter what area of her life, whether it's be her education area or her health, it's about teamwork, and it's about everyone that is involved in that team. So that's from the paid professionals to the family members to the siblings to everyone. It's about the teamwork to get the best out of the outcome that you want, and in this case, health outcomes. So we've got another slide, and I hope this one is not as clip of Hugo talking. I hope this one is not as delayed as the last one. But this is Hugo in his own words, obviously, telling what he believes is important, as we've already just heard. Let me play.
My message to kind and respectful. Explain to me what happened to my body. And I understand.
Explain to me what's happening to my body so I understand. And that sums it all up. Use a language that is appropriate for that person. The final thing that we'll talk about is language itself. That's a photo of 9 of the 10 health ambassadors at Canberra in March at our official launch. All very, very, and rightfully so, proud of the positions that they have obtained. But yeah, language is very important. People with Down syndrome and intellectual disabilities and disability as a whole are not the disability. They are a person first. Down syndrome is not a disease. People don't suffer who have Down syndrome. They just have Down syndrome, and that just is part of what makes them who they are. There's typical is preferred as a word over normal, because I'm not really sure what normal actually even means. That's just a little bit of, Down syndrome is without the S in Australia. And we like to use balanced language when talking about prenatal diagnoses as well. So it's having a chance, not a risk. And it's the slant that risk infers that is not what we believe to be appropriate language. And obviously the use of evidence-based information when talking about a life of someone with Down syndrome, and the evidence around medical, other medical conditions that can occur for a person with Down syndrome is really important. So obviously all adults that have Down syndrome don't end up having Alzheimer's, and all children that are born with Down syndrome don't have heart conditions. Obviously in Hugo's case he does, but that's not every child. So every child once again needs to be treated as an individual. This is just a few of the resources that we believe are really useful. And when talking about the annual health checkups, we have, as I've said, the health screening tool. Down Syndrome Clinic for You in the UK, in Boston, have created an online tool. There's the chat tool that's really good. And then as a child moving into an adult, it's really helpful to have their own health diaries. So something like the CID Health Matters folder is also really, really useful. So that's ours. Now let me stop sharing. I think I've done that correctly.
Thank you, Natalie.
Thank you, everyone.
And thank you, Hugo, Louise, John, Shannon, Natalie. Now, so we do have a question popping up, and I've got another one also. There's one coming up in the chat that's for Lizzie. So one of and somebody's asking, one of the barriers, Lizzie, listed in your slides was misconceptions about legality and agency. Could you or could other panel members please expand on what this means? Is it about the formal processes like consent, or is it about bigger issues of engagement with children and young people?
Do you want me to go first, Kate?
Please do.
Yeah. I think that the whole issue around consent sometimes blurs people's understanding of participation. So they think that because really from a legal point of view, young people can consent from 14, for example. Between 14 and 16, you need generally you need parental consent and young person's consent for major decisions. And so they really think that you really can't involve people until they're 16 in things, which is crazy. And I also think they think that that's the time that young people are developmentally able to contribute, which is really not true. Like I've said, I have seen toddlers contribute enormously to decision making and also to improvement projects. So it's not but there's a surprising number of health professionals that really do. It's not that they want to, they just have a misconception about people's ability to be able to participate. And like I said, the consent kind of they feel like there's a bit of a legal issue there, and you know, are they allowed to involve children in decision making? Right, of course you are. Yeah.
Thanks, Lizzie. Would anyone else like to make a comment about consent and legality barriers that might or might not really be there? Okay, well, on to another one then that is actually more of a comment than a question. Somebody in the chat has said that their son is 15 years old and they've always found that we're very supported by paediatricians and other specialists. They've always spoken to the son, even from a very young age. They talk to both parent and child, but they find that it's at the GPs that their child doesn't get spoken to or asked questions. So I'd be interested in anyone else's kind of comments on where it happens better or maybe not so well.
I actually spoke to a couple of our families about it and they've found the same thing. One family said to me that they felt with a specialist or with their specialist they had a little bit more time. And often with a GP, if you've got 8 minutes or 12 minutes and they have to get a whole lot of things done, they're not paying as much attention and they're trying to just push people out really quickly. One thing I do know about treating young people with intellectual disability or Down syndrome, and it was mentioned as well, I think Natalie and Hugo mentioned it, is you need to be able to take a little bit more time, even if it's just adding a few more minutes in, to actually take the time to ensure that the young person understands what's happening and that has the opportunity to speak if they want. Quite often we find with kids with Down syndrome, it'll take them a little bit of time to listen, to understand, and then to think about what they want to say. And it is really important that you're able to do that. So we certainly have heard often with GPs, huge time constraints mean they're pushed in and out quite quickly, unless you have a really good one.
Yeah, time really matters for good quality conversations and the ability to perhaps follow up later as well. Natalie?
Can I talk to that one as well, Kate? Yeah. I think that's kind of twofold. The specialist is obviously a specialist. They have more interaction with the people with the intellectual disability, so therefore more confidence in treating and knowing the conditions associated. And you probably often find that the GP in their whole cohort of patients have very few children or young adults with the disability. So it's that lack of general knowledge. So the annual well health checkup is really important, so that GP gets to know that person when they are well, when they're feeling on top of themselves, and when they're really willing to communicate. I mean, we all know that when we feel unwell, you don't really feel like talking too much anyway. So that's a really important part, and that really needs to be started when they're young, so that they're very familiar with the environment of the GP practice and the GP themselves. The other thing is, which is on our health screening tool, annual health assessments do have a special Medicare number, and you can get extended time periods, and the GP can Medicare that. So that's another really important thing for people to be aware of, that you don't have to be constrained to that 10-minute, speed date with your GP. It can be a longer appointment, so that GP can get to know that young person and give them the time that they need for anything that they're there for.
Thanks, Natalie. And just like John was saying earlier, it does come back to the relationship that you can build, a lot, some of that quality of care that you can get. And it's great advice, I think, for anyone managing long-term conditions or conditions that go up and down, where, getting your doctor to understand what's normal for you is really important. So we're almost out of time here, folks. So I'm just going to finish with one more question. We've heard about the importance of relationships. We've talked about, I think we talked about perhaps making a list of things that were things you could take into your appointment, and the importance of being kind and helpful when you're either a health professional or a patient. Really, it's all about that relationship. Is there anything else that either our speakers or in the chat perhaps people would like to say about one thing that you can do to really encourage and support young people to get involved in their own health decisions. And I know, Shannon, you'd spoken to a few people about some tips that they had, so you might like to kick us off with a few things. But feel free, online folk, to pop it in the chat if you've got something to say about tips you would give.
I think every person that I spoke to said preparation was key to adequately prepare a young person for a medical appointment. I guess that's really hard in an emergency situation, but if this is an appointment that you're going to that you can talk about beforehand. We had a mum talk about preparing her 5-year-old son to have just an examination on his tummy. He was really frightened of having people touching him. And so they did a lot of role playing at home. And this is stuff that Lizzie was saying. So it's for kids with and without disabilities, it doesn't matter. But they did role playing at home when he went to the doctor's surgery. He said, or mum said, well, I'm going to show the doctor how we examine your tummy. And so mum did it first, and then the doctor was able to do that without any tears at all from the little boy. And that was because they prepared him for it. So I think preparation is probably one of the big things parents are telling me.
Thank you, Shannon. Would anyone else like to add to that? We're almost out, but we've probably got time for one more.
I think also you can train your health professional, I believe. And I think that all families and their children and young people, you know, can train health professionals that they have contact with, just to the extent that they can be involved, and how it is a much more positive experience for everyone involved, for the health professional and for the child and young person and their family.
So am I understanding you to say that, you know, that the family could think of it as part of their role to help train the health professional?
Yeah, I think so. Every interaction is a potential learning opportunity for the health professional.
Great. Okay, well, I think that might be a good way to finish up our chat. I would love to go on, but we're out of time. So I'd really just like to finish by thanking Lizzie, Hugo, Louise, John, Natalie and Shannon for joining us as our speakers today. It's been a fabulous chat. And for our online folk, I'd like to draw your attention to the evaluation for today's webinar. As we're about to leave, there'll be a link appearing in our chat any moment now, and we'd be really grateful if you could just spend a couple of minutes letting us know what's been good about today, what we might need to improve, any thoughts you have for future speakers or topics that you would like to hear about. We find that really useful as we try and make webinars that are good for people. So this has been a Canberra Health Literacy Network event. We'd love you to visit the Canberra Health Literacy website if you'd like to know more about what we're doing. And you're also welcome to call or email the Healthcare Consumers Association for more information. There are plenty of health literacy opportunities to get involved in this year. And again, there are about to be links in the chat to all of those things, and we will circulate the slides for you after today's event. So thank you everyone once again for joining us today.